Very good morning, ladies and gentlemen. How come that something with such phenomenal clinical effects is not part of the day-to-day clinical practice of our psychiatrists and also other specializations? How come that psychotherapists, family therapists and psychologists don't work with this miracle? How come that it has taken 20 years that we have 500 conclusions of sophisticated clinical trials that prove that what Tomáš Palaníček presented a while ago, 3 case studies, is not a random result? But let me follow up on Professor Horáček, Professor Fremetin, and Tomáš Palaníček, and let me take a look at the problem from the clinical perspective. That is basically taking a look at trauma from my psychiatry practice. And if we take a look at this and the prevalent psychiatric paradigm as opposed to the novel approaches. So you may perhaps argue that we have antipsychotics, antidepressants, third, fourth generation drugs, and well, we have some possibilities. All of that is true, but still there is prevalence of pharmaco-resistant depressions, PTSD. We've heard the results that prove that a large part of PTSD disorders are resistant to pharmacotherapy. Well, yes, but psychiatry, and well, some critics say that psychiatry is at the level of other somatic medicine fields, at the level of the 19th century medicine before antibiotics came, where only symptoms were treated. So you would get a painkiller if something would hurt. If you couldn't sleep, you would get the hypnotics. You know, I'm not such a shuddering critic, but in my day-to-day practice, I still see the limit of the contemporary psychiatric treatment. So yes, we mainly do treat only the symptoms. We do not know the etiological treatment. The figures that I could give to you, well, we've heard most of them, so just very briefly, 1 in 8 worldwide struggles with a mental health problem, 14% of adolescents, some 800,000 people in the Czech Republic suffer from depression and anxiety in the Czech Republic. There is the overuse of psychoactive drugs that are the OTC drugs, the benzodiazepines, etc., and all that. They are overused not only because they are broadly available and work in a certain manner, and how they act is that they have higher efficiency compared with other drugs. But there is one problem: they create addiction. So, yeah, it's really no improvement achieved. If we look at the prevalence of the use of these psychoactive drugs, nearly 1 million of Czech citizens overuse them. Some of them actually use them as prescription drugs, others don't. But even those who use them as a prescribed drug don't use the correct doses. A study conducted by the National Institute of Mental Health conducted a survey among 9th graders. In the COVID times, probably these figures don't come as a surprise, but moderate severity depression in 40% of 9th graders, and severe anxiety and depressions in 30% of the 9th graders. So that does deserve our attention, even in the post-COVID-19 period. And if we look at the clinical indications for the treatment using psychedelics and assisted therapies in addiction disorders, which are psychiatric diagnoses. And there we see a very low efficiency of the existing treatments. Professor Vermetten mentioned a lot, so let me skip, but let me just say that we have many stresses here. We are globalized, highly individualized IT society, a lot of social network impacts, psychosocial stress factors, economic stress factors, war, COVID, biologic predispositions, etc. So these stressors are well known. However, how do they work in our brain? What do they do to the brain at the level of emotions, experiences, and the conscience? Do we know everything about it? Well, we know some of it, not all of it, and perhaps it may come as a surprise to you, but that's us, well, not in the center of our galaxy. It's just a metaphor that allows us to understand that we are part of something that surpasses us. We may call it global connectivity, perhaps. Professor Vermetten mentioned Stanislav Grof, Czech psychiatrist, and Stanislav Grof is also one of the key founders of psychotherapeutical transpersonal psychology. And the reason why I use this metaphor is that it was fascinating to see that some 2 weeks ago, scientists from Harvard University, neurobiologists, who teamed up with the magic of those familiar with modern technologies. And, well, these are fascinating figures, so I've presented the results here. And what they measured was that in 1 cubic millimeter of the brain tissue, so if we want to save data that we obtain from this 1 millimeter of the brain tissue, we need memory capacity for that sake that represents 1.4 petabyte of data. And when I read the conclusions of this study, well, actually, I must say I didn't know what petabyte was. So it's 1 million gigabytes, to give you an idea. If we extrapolate the information data bank of one human brain, so if we extrapolate it to the whole brain, so basically it's 1.6 zettabytes of data storage space, and again zettabytes. So this is 1 million of petabytes. That's zettabytes. If we would want to store this data in a data center instead of storing them in the human brain, we would need 140 acres of land. It would be the biggest data bank or data center worldwide, and for that we would pay, well, based on average prices, we would pay, say, $50 billion for that, for information, to put it simply, contained in just one human brain. So that's something that I find absolutely fascinating, and it's an answer to the fact that we really know a lot about psychiatric disorders, but there is much, much beyond that we don't know yet. And let me follow up on Tomáš Páleníček. And this is evidence of what goes on in the structures of our brain after psilocybin is applied. So compared with placebo, the brain activity is completely different. So you see that it's much higher. And here, I must say that this actually makes it possible to allow to collapse the highly organized brain activity. And our brain has the ability to come to terms with trauma, but psychedelics can assist in this respect. And not only do they allow this highly organized activity to collapse, that supports the dysfunctional patterns of behavior and thinking that we don't see in psychiatric symptoms, but can also create a new activity in other spaces in the dramatic differences that you'd see on the slide before. If we look at various traumas, be it perinatal trauma, postnatal trauma, the early stages of the development of the human psyche, in clinical practice, we see that a major part of the pharmacoresistant depressions and anxiety disorders, PTSD, and addictions, also eating disorders and other psychiatric diagnoses, that a significant part where we do not manage to treat efficiently with the available interventions, including pharmacological treatments, has something in common with trauma and the burden that creates certain stereotypes and behavior patterns that then to the outside appear as the typical symptoms. And as Professor Fermentin mentioned, that working with trauma is a matter dear to his heart, mainly in war veterans. For me, it's also an issue dear to my heart. However, I work with trauma from perinatal and the early postnatal age that I encounter when I see patients in my office. And what do these traumas result in? Polypharmacotherapy, polypsychotherapy, high prevalence of self-harm and suicidal attempts, low efficiency of treatment, extremely low efficiency of treatment, I should say, especially in the addiction disorders. The essence of trauma means that we basically recolor the emotion using a strong negative experience which has an impact on our experiencing our ability to be joyful and satisfy our needs. This is all we are well aware of. And how does the body adapt to trauma? I must skip this for time constraints, but what is important is the role of a part of our brain that is called the amygdala and the prefrontal cortex. So to understand the psychedelics-assisted psychotherapy, we must first understand the essence, the nature of trauma, and the importance of the early emotional attachment and its shortcomings, sexual harassment, insufficient care, insufficient bonding in addicted mothers, it's clear, but then it may not even be that the parents are at fault, perhaps it's preterm babies, etc. And the baby didn't have this emotional attachment as a result of that. So the safe attachment in early childhood then leads to a self-narrative that tells me I can manage, I'm loved, and I can love others. I'm good. And then vis-a-vis the outer world, we can say, well, I can trust people. The world is a safe place. People will help me. But then there is the endangering attachment where the self-narrative says, I'm bad, I won't manage, I'm not loved, don't trust anyone, the world is full of danger, people will hurt me. And for a large part of severe psychiatric disorders, this is crucial. This is the relationship between the prefrontal cortex, head of our emotions, and the amygdala, that could be called a place where trauma and stress manifest themselves most. So this is what it looks like in a traumatized person. And this is what it looks like in a person who is healthy or was traumatized but is undergoing psychedelic-assisted therapy using MDMA. So what conclusions can we draw from all this? Certainly, psychedelics are an opportunity to treat what's currently untreatable. Clinical trials show that the treatment is extraordinarily efficient. The safety profiles of psychedelics-assisted psychotherapy are fantastic compared to antidepressants, for instance, and their side effects. Even it may be that this could be the etiological form of treatment. So, in the end, it may be that not only are we free from symptoms, as Professor Vermeten said, but we may even expect to be cured of these disproportions in the brain, the emotional brain of those who underwent trauma. So this is a great promise for the treatment of addiction disorders. And second conclusion to draw, what does that mean for healthcare policies, especially looking at the National Psychedelic Research results? Well, all the institutions that are the co-organizers of today's conference also contributed to the National Psychedelic Research with very robust results. We should do the psychedelic harm reduction and promote the therapeutic potential psychedelics, MDMA, ketamine as the only legally available substance, most often prescribed off-label. However, if we look at what has been going on with MDMA from 2004 to 2024, our moral imperative is, and let me follow up on Professor Vermeten, not to wait another 20 years to achieve progress in this field. We must introduce systematic education, psychedelics-assisted psychotherapy. Well, it's something that, well, psychedelics don't just treat on their own. They are a carrier, but we need trained experts for that sake to assist. And as for the legislative framework, this needs to be amended. The new psilocybin bill will go to the Chamber of Deputies. Once again, it's our moral obligation to see to it that there is a change achieved, and we need to include the psychedelics in the strategic policy documents, addiction treatment documents. I remember that together with Professor Marcingo, we wanted to persuade the National Council on the Treatment of Addictions to negotiate the results of the research done in psychedelics. So there are indeed huge challenges, and we owe a lot to our patients. The national psychedelic research, whether new psychiatric paradigm is being born, whether this be a revolution or evolution, as Professor Vermeten hinted to, well, I'm not sure. But this paradigm that's being born anticipates neurobiological research, clinical, preclinical studies. How does that affect the drug policies? Well, not much so far, but the UN adopted a resolution this year where it defends harm reduction after 30 or 40 years that we've been addressing that. And what we can see behind that is number of saved lives. How is the modern neurobiological research reflected in the political decision-making on drugs? Well, slowly, but at least to a great degree. And maybe ask whether psychedelics are drugs. Well, certainly not. And neurobiological research is not just about psychedelics. And with that, let me thank you for your attention.